Dr. Timothy Quinn with us, and today we're going to talk a little bit about breast cancer and the guidelines that women should follow as far as getting checked up.
Right. Well, breast cancer, it's advised that every woman at the age of 40 get a screening mammogram. In addition to the breast, manual exam at the physician's office. This is very important because if breast cancer is diagnosed early, the person's life can be saved.
Why is there such a high incidence of breast cancer today?
Well, the deal is, unfortunately, especially in the state of Mississippi disproportionately, we're not going and getting those screening mammograms at the level that we should. So the deal is, when women are being diagnosed, in a lot of cases, it's too late. They can feel, like they'll come and you'd say they can feel a mass. Well, chances are it's probably already spread at that point.
So you want to catch it on the microscopic level?
That is correct. You want to catch it on the microscopic level. The mammogram, for a lot of women, they say it might be uncomfortable, it's painful, it's humiliating. But I'm telling you, for all those women out there in the listening audience, if you have breast cancer that has metastasized to other organs, you can't measure the pain. So it's really important to go get that mammogram because it can diagnose the breast cancer at the microscopic stages, and that person's life can be saved.
So if they diagnose it at that level, at the microscopic stage, what is the treatment to eradicate it?
Well, in some cases, they'll do what's called a ultrasound guided biopsy, and basically they can take the mass out, and what they do is they do a pathological exam to look at the surrounding tissue, and if all the surrounding tissue is cancer free, in some cases that's pretty much the end of it. Sometimes they'll do a CT scan or MRI to look for lymph node involvement, but that person might get a small dose of chemo or radiotherapy. But the key is to diagnose it early, because if you diagnose it early, in most cases, that person's life can be saved. But the only way that can happen is if women go and get those timely mammogram screens.
So mammograms are the way to go.
Oh, most definitely.
That's the best way, right?
That's the best way. Now, before getting a mammogram, the patient will go see their physician and get the breast exam. But it's so funny because I had a patient recently that said, you did the breast exam, you didn't feel anything, why should I go get the mammogram? But what I explained to her was, even though I didn't feel anything, you still want to get the mammogram because the mammogram can pick it up before it can even be felt by the human hand.
It could be as small as a pencil, the head of a pencil.
Microscopic.
Amazing.
Even so small you can't even see it with the naked eye. But the good news is, if you get it diagnosed at that stage, it can be removed in the surrounding tissue, and you're safe.
That's great. Doctor, thank you for being with us.
Thank you.
That's Dr. Timothy Quinn, and we'll be right back after this.